Hello, my name is Derek Resson. I'm the Director of Special Services here in Warren Township Schools. I want to thank you for taking the time to watch and view this presentation as it's one of many resources that we are providing to our staff and our community as the school year begins for the 2021 school year to, again, support our families, support our students in the various aspects of their academic and social-emotional learning this school year. This presentation is about helping children cope with changes, resulting from COVID-19. And this is really geared towards our educators and our families and how they discuss and talk about things with their children. And I hope that this presentation will be helpful, again, to share just some brief strategies and ideas that I think would be helpful in just kind of supporting our students through and our children through this time period. So the first one I wanted to start with is really stressing the importance of staying calm, listening, and offering reassurance. We are role models for our children. They learn from our example. So I want to encourage everyone to really be aware of how you talk about COVID-19, how you explain social distancing, and understanding the impact and the importance of taking those types of precautions to keep everyone safe, to demonstrate a variety of activities to help keep our students calm, whether it's breathing exercises or meditation or religious practices that can really help them stay calm and stay centered and grounded, as they go through this time period. Focusing on the positive is extremely important. Making sure that we're looking at the glass as half full and not half empty. That we really reinforce and encourage that for our students and our children as well. Maintaining a daily routine is essential, really, to help provide consistency and continuity in our daily lives. And then also, too, is to maybe even turn the focus on other things, too, from identifying projects that might help other people, to help others, to serve others, to take the focus off of oneself and then look outward and to see how they can support, and your family and your classroom can support others. And then lastly, we want to offer lots of love and affection and support to our students, to our children, to let them know they are cared for and they are valued and they are appreciated, and that they mean everything to us. So I just want to start with that. Again, staying calm, listening, and offering reassurance. The next thing is monitoring television viewing and social media. As you know, there's a lot of information out there, and so I want to encourage parents and guardians and our staff as well to monitor the television, the internet, the social media viewing for themselves and for their children. Watching continual updates can increase anxiety and fear in our students, and so I want to encourage us to really be judicious with what we do and how we do it and the information that we get. Certainly, there's a lot of rumors and inaccurate information out there, so please, take the time to explain to your child if they bring up something that doesn't sound right. That there's a lot of information out there, stories, rumors, and inaccurate information. So really focus on the facts with your child and really reinforce that with them to help dispel some of the maybe anxiety that comes from not knowing what's really true and what isn't. Also provide alternatives. Engaging your child in things that don't connect to a device, I think, is really important. And I want to encourage you to do that. Doing activities in your home, playing games, doing activities outside, or just breaking from the normal routine of the connectivity to technology, I think, is really important. And so monitoring television viewing, social media, I think, is a key part of that. Take the time to talk to your students and to your children. Let their questions guide you. Answer their questions truthfully, but don't necessarily offer additional information. Give them what they need to know. Avoid giving them too much information. Oftentimes children may not talk about their concerns because they're confused or don't want to worry you. But yet they do absorb the information. They're very perceptive. So, take the time to listen to them, asking their questions, to answer them for them and, to answer them and, give them the information that is appropriate. And I think that's going to empower them. That's going to give them the confidence and the control over the situation as much as they're able to. And I think having that sense of control, we know, research says it does reduce fear, and it gives us some predictability and just consistency in our daily lives. Be honest and accurate. Certainly correct misinformation. Children we know have a great imagination, but sometimes it can get the best of them and be worse than what is real. So offer the right facts to reduce those fears. Explain safety. Tell them teach them, tell them about COVID and about what steps that they can take to be safe, and stay up to date on the facts. Knowing what's current. The CDC has great information that is very helpful, and other Department of Health resources are very useful in giving information that's current and real about the disease, and how to respond to it is very important. You want to keep the explanation age appropriate for our early elementary students. Be brief but simple. It balances the facts with the reassurance that we're there to take care of them, that the adults in school and the adults at home are here to take care of them if they get sick, and that we will be there to support them. Upper elementary and middle school, this group is sometimes more vocal in asking questions, which is a great thing. They may need assistance, though, separating the rumor and fantasy from reality. So please take the time to do that and correct when you can. Also, for our upper, middle, and high school students, things can maybe discuss a little bit more in depth. They're a little bit more mature, that they can handle some of those discussions. But again, at the same time, you want to make sure you're providing honest, accurate, and factual information about COVID-19. And for all kids, for all children, encourage them to verbalize their thoughts and be a good listener to them. Let them talk this through. Let them share what's they're going on. That's where sitting down at the end of the day, around the dinner table or just at home at night, just to have them those conversations to talk about what's going on and how their school day was, and making sure that those conversations are healthy and age appropriate is very important. You want to stay connected to school, and I think we, in Warren Township Schools going forward, from where we were in the spring to now too, we want to make sure that you stay connected to us. A lot of information has been shared and will be continued to be shared about resources for your students. Whether it's through distance learning or hybrid learning formats, identifying additional resources and those things will be continue to be provided, but also, continue to look for those and to be accessible to them. Stay in touch with us, ask questions, reach out to your teacher, reach out to your guidance counselor. We are here to support you as you help your students engage in the hybrid learning or the distance learning model for this coming school year. And of course, please connect with us. We're here to support you. Reach out to your child's teacher and other staff if you have concerns about, your students, whether it's academically or social emotionally. We are here to support you. We want to give you everything that we can to make this a great experience for your student for this coming school year. And we greatly appreciate that homeschool partnership, as it is essential for your child's success in school. We also want you to know the symptoms of COVID-19. Again, just the being current and knowing what is important and what is necessary. The symptoms vary, as we've seen, from a variety of different types of people and what it looks like. But again, knowing the facts is very important, and knowing how to treat and how to address it and what to do. And again, we will, as a district, be communicating and sharing with all of you and with our community the steps that we are going to take to make sure that our students are safe. And those resources are going to be shared in the coming days. But we want to make sure that that we are very connected to our leadership, our community resources, our health department, and educators around the area to make sure that we are and are in tune with the current information that's out there about COVID-19 and how to make sure that we keep our school district safe, and most importantly, we serve the needs and meet the needs of your students and keep them safe and well. Also encourage you to model basic hygiene and healthy lifestyle practices. It's practicing daily hygiene, encouraging your children to wash their hands, and whether it's singing a song or doing something to make sure that they they wash their hands well, using using a Kleenex or sneezing or coughing into the elbow, knowing that handshakes and hugs need to be limited, or trying that air high five goes a long way, but also fostering a sense of control and what your child can do to prevent infection. and it also reduces anxiety, and also build the immune system. Take care of your bodies. Eat well, sleep well. Just practicing these good lifestyle practices and hygiene habits are going to go a long way to keeping everybody and your child healthy and safe. And lastly, I want to encourage you to be aware of your child's mental health. Most children are going to manage well with a supportive family, but some children may demonstrate intense reactions, whether it's anxiety, depression, and even suicidal behaviors. So risk factors, there's many, but includes mental health, trauma, abuse, instability, loss of a loved one. Caregivers should I strongly encourage you to contact a professional if children exhibit, significant changes in behavior or symptoms for more than 2 weeks. And some of those are listed below. You'll see preschoolers, elementary school children, adolescents. These risk factors, these behaviors are often indicative of some other mental health needs that your child may be experiencing. And so if you see these things, please contact us. Please, partner with us so that we can support your child well, and then also connecting them to outside resources, professionals in the area of mental health. Physical and mental health are very important. And so I want to encourage you to do that as well. Lastly, I want just to kind of conclude the presentation, I want to just leave you with some resources here that I've used as part of this presentation. But again, we have a repository of information on our district webpage, and there's a variety of resources from the CDC, from the Department of Health, Department of Education, that really could give you some information on how to best meet the needs of your students and your children. I want to thank you for the time that you've given to me today. I hope you found this presentation helpful, and certainly refer to it as you go forward. But again, I want to wish everyone the very best. Be healthy and well as we start this school year, and we look forward to working with you and supporting your children as we start the 2021 school year. Thank you.